Hello everyone, my name is Landon William Gishel, and I'll be sharing some facts about depression in teens. So first I want to talk about my friend from Baltimore. Her name is Sophia. She was diagnosed with depression at the age of 13, and she's 15 right now. So that's 2 years with depression, which, really, what is depression? I'll explain that in a minute. So depression is a mental condition that does affect your emotions at any given moment. These emotions that you can feel could be either sadness, hopelessness, anger, or even anxiety. Depression is common between teens in high school and also teens that's graduated from high school going on to college or going on to pursue their own career. So teens with depression don't really talk to many people when it comes to having depression, because depression will affect your anxiety, and with your anxiety being affected, you're afraid that people would see you as a person that would be an outsider of a friend group. Also, depression can also affect your grades in school. When you affect your grades in school, that's when it gets really bad. With it affecting your grades in school, that will lead to terrible grades, terrible test scores, not getting good high schools, not even getting good jobs. Also won't even be applied by or get even into college. So according to MayoClinic.org, it actually stated that in teens, symptoms may include sadness, irritability, feeling negative and worthless, anger, poor performance or poor attendance at school, feeling misunderstood, and extremely sensitive, using recreational drugs or alcohol, eating, drinking, or sleeping too much, self-harm, which would be basically like cutting yourself, anything like that, loss of interest in normal activities. So basically, what they would do all the time, they don't want to do that no more. They just want to stay home, do whatever. Just want to stay home, basically. And also, they want to avoid social interaction. So they basically want to avoid people. This explains why most people with depression don't really care about their grades, because they always get flashbacks about certain things and start remembering certain things that will affect them in the future. And also, according to MayoClinic.org, it stated that depression isn't a weakness that you can't just snap out of. So basically, it's not like a one-time done thing, or it's not even just a one simple thing that goes away in a couple of weeks. This takes years. This takes about a year, or like probably even 4 or 5 years to overcome. To overcome depression, it's kind of a difficult process. So basically, depression is a long-term treatment. You need years of treatment. No matter what age you are, you need years. It's going to take years for depression to go away. But also, the main things that they would use to help lower your depression would be medicine, which would be medications, and also they would also use psychotherapy, and they would also even use both. If you have it that bad, you have to use both. And according to MedlinePlus.gov, it stated that through your genetics, you can also get depression through your brain biology and chemistry with other people. Well, not with other people, no. Hormones, so basically the hormones that are in your body, they can change and contribute. So basically all the hormones inside your body, whatever it is, they will change and in turn to contribute to your depression. And also stressful childhood events. So this is basically the stuff like abusive fathers or family past that have affected you over time, like crimes that your parents have committed, all kinds of other certain things that can affect anything. Basically, deaths, drugs, anything. Depends on what you take of it. And basically, I don't want to use the word hate because it's kind of a strong word for me to use, but I just don't like depression. Depression isn't a good thing at all. Depression basically has been through my life. Not through my life. Well, between my friendships for certain people, like as I mentioned Sophia earlier, one of my friends in Baltimore as well lost their grandmother. His grandmother was very Irish, very close to my friend, and he was way upset. He was too upset that he would always cry about it every day, no matter what mood he was in. But also, according to MayoClinic.org, it also stated that in teens, symptoms. Oh, wait. Okay. So basically, I got a list of different mental disorders that teens could go through. So other things that teens can go through could be such things as depression, or what, in other words, bipolar disorder. Some other disorders that you can be affected with are anxiety disorders, personality disorders, psychotic disorders, eating disorders, so basically eating all the time no matter what mood you're in, and also trauma-related disorders such as post-traumatic stress disorder. But yeah, mental disabilities are the worst thing that could happen. Well, not the worst thing, but it's a bad thing to go through. And all these bunched up together, basically, I'm just trying to say, no matter what mental disability you have, think of it as your way to tell you to go see somebody, get it treated, so then that's out of your life. You don't have to worry about it. As soon as that's gone, you're fine. You can just live as you wish to be.